So I was invited to participate in an ICER evaluation in March, just as honestly as a mom of a child who had SMA. So it was just my testimony of my experience as a family burdened with such a rare disease, and I just shared our burden and the way we felt and the effects that SMA has on our family and the far-reaching effects of SMA. So. I would give advice, let's see. Well, I would say this, it's a very overwhelming experience. You do feel like a very small fish in a big pond. It's a very cerebral experience. A lot of clinical jargon that, we as lay people don't understand so much, but our value as families is in our story. They're not going to get the story from anyone else but the ones who are in the trenches. So I would encourage every family to just really dig deep and decide what's really valuable to them in the situation with their family, and really share that with the panels. I think it's absolutely necessary with especially rare diseases and high payouts for drugs that just are astronomically expensive. When you look at it on paper, it's ridiculous. It doesn't make a lot of sense. But then when you really get into it and get comprehensive data that shows what the actual effects are for the patient. The only way you can do that is by speaking with families and patients and really getting in the trenches and understanding how it affects day to day, because the equations and the data by the powers that be they're not going to get what's happening in the home, with just the complexities of life. So I would really encourage families to just participate, get over that fear of not knowing, and just contribute your story and let the powers that be know what's going on so that you can best advocate for your patient population. I'm a positive outlooker. I choose to focus on the positive. It's been a devastating experience. We actually lost our son when he was 2. Thank you. But we have hope. We're actually expecting another child currently, and we have hope because there's 2 approved treatments for this disease now, and when we had our son there was none. So we're very optimistic, and I can't help but feel that our contribution to the value assessment has somehow in some tiny way contributed to the approval. And so there's a lot of hope, because there's the lifelong effects of SMA for this child that we're expecting is 1,000 times better than the best case scenario for our child just 4 years ago. So we're very optimistic.